Welcome back to Arthritis Broadcast Network's second annual Greek to Street event. I am here today speaking with Jennifer Pepneck. She's a knowledge broker from the University of Manitoba. Jennifer, can you give us a short introduction of yourself and your work as a knowledge broker?
Sure. So I'm a knowledge broker with two different research areas at the university. I work with the Manitoba Centre for Health Policy and also with the Manitoba Primary and Integrated Healthcare Innovation Network.
And I understand you attended the Katie Canada Scientific Meeting last week. Can you give us some highlights and what was your favorite part from that conference?
One of the highlights for me is always the opportunity to talk with people from across Canada about their work and really being able to ask them those questions in person and see how different areas across our country approach knowledge translation differently, or even to be inspired by some of the stuff that other people have done and learn from things that may or may not have worked very well. So I really enjoyed the opportunity I had to, even just for the posters, the poster presentations, I was able to walk through and talk to a number of different people about some of their work and ask some more questions that you may not have time or the opportunity to do otherwise.
Can you tell us about some of your favorite posters from the conference? Some of the conferences that have inspired you and any other KT projects that you yourself are currently working on?
One of the pieces that I found most valuable was the workshop that we did on the second day. Both areas I work with have been doing a lot more work around patient and public engagement, and hearing how other people approach it and having those budget tools and working through the budget and even thinking through some of the detail pieces that would have to go into a project and going step by step through it in a safe place with people who would have a very different approach from different project areas was very valuable, especially since I was sitting at a table with people who weren't all from the same area, and weren't even necessarily from the same provinces. We were able to talk through some differences in our approaches and really push each other further to think deeper about how we would potentially in the future do some of these patient and public engagement and reevaluate some that we are already doing.
In that workshop that you did you learn anything about across the different disease groups and the different provinces? Were there any differences that stood out for you?
For me, some of the differences, we had an individual from Ontario sitting at our table, and even cost differences for food in Toronto versus Winnipeg can be different. Your transportation costs would be different, and some of the accessibility in terms of our more rural and remote communities in Manitoba pose, I wouldn't say necessarily unique to necessarily Manitoba, but definitely a very unique to our larger provinces. Just that we have a lot of communities where it's extremely difficult to travel in and out of. So some of those troubleshooting and brainstorming some ideas on how can we get people involved but not make it a burden for them to be involved. So can we use technology to reach individuals, even reimbursement with how our institution approaches those things? How do you start working with your finance department to figure out how do we pay people for something that may not, or provide reimbursement for something that isn't necessarily the everyday yet? So really those pieces were interesting, and not that we came up with like the perfect solution, but we were able to start brainstorming some ideas, and I was able to walk away with some ideas that I can give more thought to and really look at the logistics on how we can reach some of those individuals.
And essentially, this is very important because it affects how a patient receive care and get the best care that they need. What were some of the proposed resolutions or ideas that was floating around?
We were looking at really harnessing either telehealth facilities or a lot of the video conferencing options that are out there. Just because transportation can be quite difficult, and it seems a little ridiculous to ask an individual to travel 10 hours for a 5-hour meeting. It's putting a lot of burden on them, so can we make the transportation a little easier in that they go 20 minutes to their local clinic and they use a clinic room in hours that it doesn't need to be used for patients that has telemental health or telehealth access? Or can we reach them in their own home using Facebook Live? And what are some of these other options out there? So just starting to explore that and looking through some of the barriers that might be there that we would need to ask, just in terms of what is your internet connectivity at home, in terms of supporting this, and how do we help you to ensure you can participate.
Perfect. I hope to see some of these resolutions come into the daylight very soon. And this year's theme for Katie Canada is Advancing the Science of Integrated Knowledge Translation. What does this mean personally to you and in the work that you do?
Me personally, I see the integration and advancing piece. Ultimately, I'd love to see in 10 years from now that we aren't asking the question, what is knowledge translation? Like, if I introduce myself to somebody and say, I work in the field of knowledge translation, the question isn't necessarily what's that, it's how are you doing it? And we've established the understanding of knowledge translation, especially even just in the research community, more fully, and built a lot more understanding, so it's just part of how we practice.
Thank you so much for speaking with us today, Jennifer. And I hope to see you again maybe next year at the conference and perhaps a poster presentation.
Definitely, that would be wonderful.
Thank you so much.
Thank you.